Vice President of SEIU 1199, a registered nurse, and a board member of the SEIU 1199 Northwest Training Fund. So when we decided to work on some innovative projects with our HEAT grants, and one of the pieces that we really wanted to work on was how we can make sure that there's continuity of care in the healthcare profession and the hospital, right? Meaning, EVS workers, dietary workers, front office staff. How can we make sure that although they are in contact with the patient, that we make sure that they have the skills that when a patient escalates, especially a patient with behavioral health issues, when there's that escalation, that they know what to do. So we got this pilot from Massachusetts. They had a pilot program, and we created our own using some of their curriculum. It's an 8-hour curriculum that makes sure that our members reflect on what they do when they encounter a patient with behavioral health, in a behavioral health crisis. Really have to take into consideration that, the patient, that it's nothing scary. We're trying to really demystify what somebody with a behavioral health problem has, so that people are not scared to go in the room to give food to the patient, right? But we really worked on really thinking about being self-aware, right? So when you walk in the room, you gotta really think about your biases and the things that you already know, and making sure that you keep yourself safe, keep the patient safe at the same time, and knowing what to do when that happens, right? You walk in a room, there's a situation going on, there's an escalation. What do I do as a healthcare worker to make sure I keep that patient safe, and we keep, yourself safe as well? What is really interesting about this pilot is, most of the people that really are having the training are people of color, right? Lower paid workers that technically they don't really have de-escalation training. Usually do it for nurses and CNAs, right? But these are people that don't have that. But we feel that it's really important for the continuity of care for the patient, to make sure that everybody's hearing the same thing about, how to keep patients safe and to demystify behavioral health.
My name is Jean Doherty, and I'm chief nurse for Swedish Edmunds, which is located in the Seattle area. And I am here to share a little bit about what we're doing with an innovative project with SEIU Healthcare 1199 Northwest and the Training Fund in a collaboration. The Training Fund, I'll just call it that, the Northwest Training Fund, has a special fund that they call the Responsive Programming Fund. And that programming fund accepts applications that are jointly sponsored by the organizations and by labor, to say, what could we do that we could really improve and innovate? So this, I'm going to share briefly about a mentoring pilot that is focused on RNs. We developed this pilot in response to RNs actually asking us to say, we think we need help. After nurses go through a formal orientation and precepting and really enter practice, that there's a vulnerable period. And during that vulnerable period, we believe that it would be very helpful and beneficial to mentor nurses. Nursing turnover is a very big problem across the country. 14 to 16% turnover annually is common. And when you think about the cost of that for an organization, the range is in the literature varies, but somewhere between $61,000 and $74,000 to train and replace a nurse that has left. So retention is a win-win. Developing strategies during a vulnerable period to help a nurse stay in place can be very important as they're entering practice. So this pilot project is about an pathway for mentoring. It's kind of like a Match.com. They're jointly working with the training fund, with labor, with management, and nurses, frontline nurses, we developed a platform on a e-platform that allowed us to match up mentors and mentees. We launched a project that involved 28 total mentors and mentees, and we're just at the completion of the project phase and in the evaluation step. Overall, the anecdotal results and the communication from both the mentors and the mentees have been very favorable, very positive. We just now will be looking at how do we take the next step to continue to mentor. Thank you.